Okay, we should probably get started. Maybe if someone could close the door in the back there. Okay. My name is Joe Bufil. I am with the Burr Oak Foundation, which is a new scholarly initiative serving the academic community at University of Michigan. I want to welcome everyone to this a panel, which is entitled In the Shadow of Success, COVID-19, John Henry Newman and the Dignity of Patients and Learners in Medical Education. I think when we think of John Henry Newman, the idea of medical education is not the first thing that comes to mind, but he did have quite a bit to say about healthcare and medical education. So this is going to be a very interesting series of lectures. Our speakers today are Brett Robinson. He'll be first. Many of you know Brett already. He's the Director of Communications and Catholic Media Studies at the McGrath Institute for Church Life here at Notre Dame, where he oversees outreach efforts for the Institute and conducts research at the intersection of religion, technology, and culture. Brett studied marketing and English at Notre Dame and received a PhD in mass communication from University of Georgia. Most recently, he's published a new book entitled Appletopia, Media, Technology, and the Religious Imagination of Steve Jobs, which is available in fine bookstores everywhere. Our second speaker, and Brett will be speaking to the topic of what John Henry Newman had to say to patients. Kristen Collier is a physician. She's assistant professor of internal medicine at the University of Michigan, and she directs the medical school's program on health, spirituality, and religion. She is also the associate program director of the internal medicine residency program, where she oversees the primary care track. Kristen did her undergraduate studies at Michigan, her medical school at Michigan. She did internal medicine and chief residency training at Michigan. So she is Wolverine, and we're very fortunate to have her here. Finally, Kristen will speak to what John Henry Newman had to say to medical practitioners. Finally, Bo Bonner will be the last speaker. He is the director of the Center for Human Flourishing at Mercy College, and he advises the president of Mercy College on mission issues. Bo received his BA in philosophy from Oklahoma State University and an MDiv at Duke Divinity School. He is involved in Catholic teaching ministries, primarily in philosophy and theology, and he will be discussing what John Henry Newman had to say to students in healthcare fields. So just a reminder to our speakers that it's important to try to stay on time, especially because at noon today, Michigan plays Penn State. So if Kristen is late for the kickoff, she'll never speak to me again. So if I am a little harsh in cutting you off, talk to Kristen about that. Thanks, Brett.
Thank you, Joe. It all started with a routine biopsy. My mom had been dealing with bladder cancer for over a decade, so tests and biopsies had become pretty common. Some were more bothersome than others, but overall, they did what they were supposed to do. But in June of this year, things did not go as planned. In the OR, the doctor handed the surgical tools to a medical resident who accidentally tore a hole in the ureter, the small tube that connects the kidneys and bladder. The resident didn't realize the injury had occurred, so he proceeded to instill a liquid dose of chemotherapy into her compromised bladder. The chemo ended up leaking into her body cavity, and over the next few days, fluid began collecting around her lungs, her hair was falling out in clumps, and her stomach was painfully distended. When I visited her in the hospital, my mom was being treated by a host of technologies. At one point, a pulmonologist came into the room and removed the fluid from around her lungs using a sonogram that fit in his pocket. A few minutes later, a nurse entered the room pushing a rolling desk, computer perched on top, bins of supplies underneath. She spoke in numbers, vital sign numbers, blood work numbers, medication dose numbers. During the entire exchange, we never saw her face, just the back of the computer monitor. I sensed that the nurse was just as frustrated with the arrangement as we were. She muttered something about hating the new software. You had the sense that tedious data entry was not what she envisioned when she felt the call to be a nurse. Since it was a teaching hospital, the faces and names of the medical staff were constantly changing, so it was hard to form relationships with many of them. They were doing their best under stressful conditions, but the mood was always taut and edgy. At one point, I asked one of the nurses if she could wash my mom's face. The nurse said yes and apologized for not getting to it sooner. She prepared a basin of soapy water and soaked some soft white towels. She gently wiped my mom's face and washed her hair. After days of cold clinical treatments, the warm touch of the nurse's hands lifted my mother's spirit. She was lighter and more animated, hopeful even. The kindly nurse's hands had done something for my mom that none of the technology was able to accomplish. They restored her sense of dignity. In this paper, I'd like to suggest that recognizing the dignity of the patient requires the ability to attend to the language of the body in ways that cannot be quantified or captured by diagnostic devices. Outside of the conjugal act, there is no more intimate, vulnerable, or potentially humiliating context for the body than the medical setting. Two bodies, doctor and caregiver, enter into a relationship that's an admixture of clinical calculation and compassion. In the midst of this are the tools and technologies that have the potential to just objectify the patient as a mere site of data collection or a problem to be solved. Such a context requires a restoration of sight that's been altered by life in a technological age. This is not sight in the physical sense, of course, but sight in the sense that Joseph Pieper puts it, quote, the spiritual capacity to perceive the visible reality as it truly is, end quote. The soul is the formal cause of the body, making bodies capable of spiritual activity, whether prayer or art or poetry. But bodies also bleed and piss and vomit. All of it, the expressive beauty and the messy anguish, express the story of a soul. The story of Saint Therese of Lisieux is a work of art and is an elegant composite of theological depth and suffering in the form of tuberculosis that would claim her life at age 24. The Catholic novelist Walker Percy would also suffer the ravages of tuberculosis. For him, it was the occasion of his soul's conversion, the story of his soul. In a conversation with one of her sisters who said to her, "We do not know of what disease you will die," Therese replied, "I shall die of death." The simplicity of her reply belies its profundity. It indicates a total and inclusive approach to understanding the formal and final cause of human existence. It's this total field awareness that's lacking in the realm of over-specialized fields like science and technology. Medical science remains preoccupied with the material and efficient causes of bodily ailments while ignoring the formal and final cause of body and soul. To read a body in this way is to understand its fullness. Christ's body both spoke divine truth and bled for our salvation. The theologian Aaron Riches put it this way, quote, "On Maundy Thursday, Good Friday's victim placed himself in the order of signs. By this gesture, Jesus is understood to have handed himself over, traditioned himself into the human economy of meaning and signification, and so into the realm of human art." The sick body is a sign that speaks. Read theologically, the sick body takes part in the suffering of Christ. This hermeneutic is possible because Christ's body became the universal sign by which we come to understand, though not fully, the mystery of suffering. When the sick patient is viewed in this way, it reveals her dignity as one who is being granted a share of the divine life through suffering. Today's doctor is not asked to read the body in this way. So why was it then that the Greek god Apollo was the god of medicine and poetry? One answer might be that medicine and poetry share the work of interpreting signs so that a meaningful narrative can be conveyed about the thing being observed. Despite moving into literary theory, the work of semiotics or sign reading was the domain of medicine for centuries. And it's precisely these types of concurrences that offer a means for imagining a type of medical education that elevates the dignity of the patient by seeing her in the realm of not just biology and physiology, but in the realm of divine art, as a thing of beauty made in the image and likeness of God. It is here that St. John Henry Newman's philosophy of education provides a useful guide. In his idea of a university, Lecture 10 is on the integration of Christianity and medical science. In the lecture, Newman recalls that bodily health is not the only end of man, and that medical science is not the highest science of which he's the subject. Newman says, quote, "Man has a mind and a soul, and the mind and soul have a legitimate sovereignty over the body," end quote. Newman compares the hierarchy of the body and soul to that of soldier and statesman, showing that they are inextricably bound to one another, but one must be subject to the other. Newman's analogy is reminiscent of the scene in Scripture where Christ encounters the centurion with the sick servant. "Lord, my servant is lying at home paralyzed, suffering dreadfully." Jesus said to him, "I will come and cure him." The centurion said in reply, "Lord, I am not worthy to have you enter under my roof. Only say the word and my servant will be healed. For I too am a person subject to authority, with soldiers subject to me." When Jesus heard this, he was amazed and said to those following him, "Amen, I say to you, in no one in Israel have I found such faith." The soldier subjects himself to the authority of Christ's divine power and receives the gift of healing for his servant. In the absence of his servant's body, it is the centurion's body that speaks to Christ in the language of compassion for his servant. His body becomes the medium by which Christ heals the servant. The medium is the message. Imagine the same scene today. Does the centurion still deny Christ entry to his home out of humility, but suggest instead that they FaceTime the paralyzed servant? "Lord, I'm not worthy to have you enter under my roof, but please send him a selfie and my servant will be healed." No, it's the embodied witness of the caregiver that mediates Christ's love and healing. Today's medical technologies add a layer of abstraction that end up translating the language of the body into a new and extended form. Think of telehealth, medical exams without bodies present. Telehealth visits skyrocketed during the pandemic for obvious reasons, but like many technological habits, it was hard to break, and the practice continues to grow. There is a certain efficiency to be gained by this, to be sure, but something has clearly been lost. Marshall McLuhan summed up the situation this way in 1964. "In this electric age, we see ourselves being translated more and more into the form of information, moving toward the technological extension of consciousness. That is what is meant when we say that we daily know more and more about man. We mean that we can translate more and more of ourselves into other forms of expression that exceed ourselves," end quote. The work of apprehending or grasping what is going on with the patient is rooted in human touch, to grasp, something the screen cannot provide. Human touch has largely been replaced by device or machine contact, as the work of palpating internal organs or lymph nodes is often left to imaging devices that generate more detailed information. While such imaging provides more accuracy, the doctor's body loses a valuable opportunity to speak through touch, the most intimate of the human senses. AT&T famously adopted the phrase "reach out and touch someone" to deflect attention from the fact that the technology of the telephone had separated bodies that desire intimacy and contact. Father John Culkin said, "We shape our tools, and thereafter our tools shape us." In today's medical environment, the risk of caregivers being formed in the image of the machines that assist them has only increased. This can be read allegorically in the Chinese story of Zhu Gong. While traveling, Zhu Gong saw an old man fetching water by hand to irrigate his vegetable garden. Zhu Gong asked the old man if he wanted to know about a way where he could irrigate 100 ditches in a day using a wooden lever and a draw well. The old man got angry and said, "I have heard my teacher say that whoever uses machines does all his work like a machine. He who does work like a machine grows a heart like a machine. And he who carries the heart of a machine in his breast loses his simplicity. He who has lost his simplicity becomes unsure in the strivings of his soul. Uncertainty in the strivings of the soul is something which does not agree with honest sense. It is not that I do not know of such things. I am ashamed to use them." This holistic understanding of the effects of technology are alien to the specialist, who focuses exclusively on the development and use of his technological tools and methods. Newman laments this exclusiveness in his address to the medical school. He recognizes that all professions come to believe through specialization that their profession is, quote, all in all, and that the world would not go on without it, end quote. This attitude downgrades the role of context that necessarily includes all disciplines that are related to and inform the profession in question. Without a context, what is the frame of reference for interpretation? Without Aristotle, what is Aquinas even talking about? Without a context for the purpose of human existence, what does the body really signify? Remy Brague writes about this loss of contextual awareness in the Kingdom of Man. He asks, quote, "In what way were cosmology and theology contexts for the anthropology and ethics that crowned them? And what happens to our understanding of the human person when those contexts are discarded, as they have been in the modern project? Nature abhors a vacuum, and we might argue here that today's context is not cosmological or theological, but technological." McLuhan describes this appropriately in medical terms. "The new media and technologies by which we amplify and extend ourselves constitute a huge collective surgery carried out on the social body with complete disregard for antiseptics. If the operations are needed, the inevitability of infecting the whole system during the operation has to be considered. For in operating on society with a new technology, it is not the incised area that is most affected. The area of impact and incision is numb. It's the entire system that is changed." Let's try to illustrate this through an experiment. Here we sit in something akin to a small auditorium, from the Latin auditus, to hear. But how is this room constructed? What kind of spatial context are we inhabiting? If the screen behind me is any indication, we privilege the sense of sight. Even when the screen does not change, you can't help glancing at its luminescence from time to time. It's visually seductive. Furthermore, in a strict sense, I'm not speaking to you, but reading to you. You don't need to see me head down staring at the page to know this. You can hear it in the cadence of my voice. You sense that this is scripted speech. It lacks spontaneity and participation. I've opted to rely on this technology of print to store my thoughts so that I can deliver them to you. The printed page is doing most of the work here. If I put it away, something happens. I'm making eye contact. This feels more intimate, spontaneous. I'm probably going to make a mistake now. I can create silence, which creates a more reflective mood. So the context can be manipulated by just the change of one technology, removing the printing page. So imagine adding all sorts of other technologies into a context and what that does to the relationship between bodies. A similar scene plays out in Plato's Phaedrus, where Socrates and Lysias debate the merits of a written speech versus a memorized one. Socrates tells the story of the Egyptian god Thuth, who showed King Thamus his new invention of writing. He assures the king this new invention will benefit the Egyptians by improving their memories and making them wiser. And the king responds in a way that is reminiscent of Newman's critique of the specialist who cannot see beyond his own discipline and professional gifts. He says, "O most ingenious Thuth, the parent or inventor of an art is not always the best judge of the utility or inutility of his own inventions to the users of them. Writing will create forgetfulness in the learner's souls because they will not use their memories. They'll trust to the external written characters and not remember of themselves. The specific which you've discovered is an aid not to memory, but to reminiscence. And you give your disciples not truth, but only the semblance of truth. They will be hearers of many things and will have learned nothing. They will appear to be omniscient and will generally know nothing. They will be tiresome company, having the show of wisdom without the reality. As a practical takeaway, I'd recommend to you a short essay, soon to be a book, by technology writer Michael Sakasis called The Questions Concerning Technology. In it, he offers a series of 41 reflective questions that speak to the heart of this body-soul technology dynamic. The list includes, what practices will the use of this technology displace? What will the use of this technology encourage me to notice? What will the use of this technology encourage me to ignore? What limits does my use of this technology impose upon others? These questions could be applied to everything from smartphones to MRIs. The point is that the answer to the questions raise to consciousness the often unconscious effects of our technology on ourselves and other people. Let's conclude then where we began, with Pieper and his essay, Learning How to See Again, where he writes, quote, a better and more immediately effective remedy to the abundance of visual noise is not abstinence from it. It is to be active oneself in artistic creation, producing shapes and forms for the eye to see. Think of the sculptor who runs his hand over many faces to learn the fine details of their lines and contours. He comes to see the human face in all of its fullness because he's chosen it as the subject of his artistic creation. He can never look at faces the same way again. He'll always see more than the rest of us. The act of washing my mom's face in the hospital room allowed the nurse to elevate her role from technician to healing artist, like the sculptor, running her hands along the lines and contours of the face, restoring her spiritual capacity to see the whole person, two bodies in communication without words, heart speaking unto heart. Thank you.
That's really pretty. That's great.
Hi, everyone. I just want to start by dedicating this paper to Dr. Tillman, who helped me understand Newman. Her dear husband, Dr. Sloan, is here. I hope I can do this topic justice. The title of my paper is The Suffering Servant and the Great Physician, Reclaiming a Vision of Physician Dignity. Much has been written about the dignity of patients. This is important work. In medicine, we are taking care of the imago Dei, the image bearers, and we mustn't lose sight of this, but we have, in part because of a malformed anthropology within medical education and medicine more widely. One that sees the patients as series of parts to be fixed, or a bag of blood and bones, or at worst, a clump of cells. It is a vision that is reductionist in its very nature, and this vision is operationalized in the hyper-subspecialization of modern medicine. A fragmentation has resulted, one that fragments persons, both physicians and patients, and one that has lost sight of the heavenly realm. This malformed anthropology has dire effects on the patients, for sure. But what is less discussed is the effect this malformed anthropology has had on the physician. We expect physicians to do whole person care. However, not only have they not been properly trained to see their patients as whole persons with inherent dignity, but they themselves have stopped being seen and treated as whole persons with inherent dignity. When we have a contracted view of man, the one that currently reigns, especially in secularized medicine, man is robbed of his dignity. And when the dignity of the physician is not recognized, there are serious consequences for both patient and physician alike. In this paper, I will discuss the dignity of the physician, its importance, how we have arrived at the problem at hand, the consequences thereof, and potentially how to remedy this using the work of St. John Henry Newman, all in about 18 minutes. And to be clear on my terms, when I use the term dignity in this paper, I mean intrinsic dignity, the value that people have simply because they are human due to the very kind of creature that they are, made in the image and likeness of God, and not a type of attributed dignity from an external agent due to accomplishment, et cetera, et cetera. So how do we get to a place where the physicians who are supposed to be taking care of whole persons have themselves stopped being treated and seen as whole persons? This largely comes down to two issues, as I see it. One, how they are being educated, and two, how they are viewed by society. At the core of this latter problem is the eroded physician-patient relationship, and this is where we will first start. The physician-patient relationship has eroded in part due to many factors, but namely is an overcorrection for the paternalism that has dominated medicine for most of its history. In the course of the larger civil rights movement in the mid to later part of the last century, the move towards greater involvement of the patient in medical decision-making came to be, and with it a supremacy of autonomy as the highest virtue that reigns the land in the Western school of medical ethics and medical decision-making. With this movement, however, the physician has been marginalized in the encounter. What was once thought of as a covenant of sorts between two people has now been relegated to a transactional relationship, one in which the autonomy of the patient reigns supreme, and the physician and her agency, humanity, dignity, ultimate concerns, and conscience is marginalized. The phrase patient-centered care is the axiom and the heuristic by and through which many decisions in healthcare is seen. However, I and many others prefer the term relationship-centered care in order to preserve the view that there are two persons coming into encounter in the physician-patient relationship, not just a patient with her own agency in a transaction with an interchangeable faceless automaton, one who purely dispenses whatever the patient feels that they want and need in the goal of what they have defined health to be. Second problem that has led to the marginalization of the dignity of the physician, and the thing we will spend most of our time on, is the education that they have received and by what they are measured in their educational journey. This education is bereft in three main ways. Four, actually. It's utilitarian in its very nature and doesn't allow a growing physician to be developed as a whole person. Number two, it lacks imagination through which the young physician would be allowed to productively wonder about the proper ordering of the goods within medicine and her place within the vocation and the world more broadly. Number three, it lacks true formation. And in most instances, number four is totally disconnected from any recognition of the divine, which is the source of all dignity. So we'll first start with the nature of their education. The pressure to get into medical school is high, and the preparation starts young. Focusing on technical fields in college and even before starts early, often at the expense of an education that would have been able to equip them for seeing persons in the fullness of their humanity and for seeing themselves in the same light. So Newman speaks of a circle of knowledge that one should be exposed to in a liberal arts education, where one has the proper exposure to all the arts and sciences, including theology, and using philosophy as like the eye through which you move through all the sciences. This is necessary in order to have a proper view of your own discipline eventually, but also to educate people as whole persons because they are being exposed to more of the wholeness of reality. So Cicero writes, quote, "In my opinion, indeed no person can be possessed of every praiseworthy accomplishment unless he has obtained the knowledge of the great human concerns," end quote. These great human concerns are nowhere more manifest than in the vocation of medicine and studied through a liberal arts education. So a truncated circle of knowledge leaves us with an impoverished view of human persons. In traditional pre-medical and medical education, what happens is that the developing physician's education progresses down a sequentially more narrow scope, eventually focusing on studying disembodied organ systems. And the effect of this is that it strips physicians themselves of their humanity and dignity, and they are less likely to see it in others. Their own fullness has not been cultivated within a liberal arts education, as they have not had the opportunity to productively wonder about the big questions a liberal arts education provides. And without this type of exposure to the rest of the disciplines, her view of her own discipline is impoverished. She is at risk of becoming a materialist. And in this model, questions of the why, specifically concerning purpose and final causation, become irrelevant and out of the scope for the physician. As Jeff Bishop has written, medicine has lost any sense of transcendent goods and has resorted to a type of materialism that has left physicians and their patients in what I call a swamp that is void of much meaning and is undignified because it no longer points to something higher than itself. When much meaning is stripped and is undignified because it no longer points to something higher than itself. And when one divorces itself from the source of dignity, it no longer has dignity. It has become self-contained, which to Newman is a total catastrophe. Out of this educational paradigm, one that prioritizes the physical sciences, often to the exclusion of a broader liberal arts education, is born a reductionist view of man as organic matter first and foremost. Newman, in his address given to medical students, warns them of a possible, quote, contracted view of man and his eternal destinies, unquote. If a spiritual nature is recognized, it is often thought of as a ghost in the machine type of animating spirit. But in most cases, the spiritual nature of man, both of the patient and the physician, isn't even recognized, and is considered outside of the purview of medical education. As Bishop has written, the result of this shift in metaphysics has led to a paradigmatic change in medicine and medical education. Thus, he writes, quote, "Medicine has become thoughtless. Medicine is primarily about pragmatic doing and efficient control, ordered to utilitarian maximization and its own practicality," end quote. In this new model, medicine became a profession turned in and on itself, freed from the influences of metaphysics and theology historically associated with the church. But without a proper relational grounding, we risk churning out technicians who see their patients as at best molecules in motion, and at worst mere machines, and the physicians start to see themselves in that same light. This type of education threatens the spiritual well-being of the physician as well, which I will address a little bit later. So how many times have you seen a physician who majored in studio art or viola performance or theology? It happens, but not as often as it should. The student who would major in these things along the way would invariably be asked such questions by good-intentioned people such as, like, what does viola performance have to do with being a good doctor? And what you should really say to that is everything. So Newman reminds us that when we have a contracted view of man, we are not connected to the divine. And there are real consequences that flow out of this in medicine. He writes, quote, "After all, bodily health is not the only end of man, and medical science is not the highest science of which he is the subject. Man has a moral and a religious nature as well as a physical," end quote. So when we have a contracted view of man and see him only as a body, this robs him of his dignity because there is no honoring or recognizing in him of how he's made by our Creator and belongs to him. And when we have a contracted view of education, the student also suffers. Health is good in and of itself, just as knowledge is. And when we've ordered medical education towards utilitarian focus, we rob the student of the proper environment in which to become whole and see her patients as such. Just as there is dignity honored by looking beyond the purely physical complaints of a person and seeing patients in the totality of their humanity, there is also dignity that is affirmed by educating students as whole persons. In medicine, we see this as looking like not only what is wrong with your organ, but what is wrong with you. And Jesus Christ did this all the time as the great physician. He saw people in the fullness of their humanity, and we should strive to do the same, both as physicians and medical educators, as this is dignity affirming and recognized as a higher anthropology. The other factor that contributes to physicians not being able to see the whole person and themselves not being seen as whole persons is that we've lost the notion of true formation in medical education. Because the word formation implies some type of morality that medical education really wants no part of, as the very word or concept seems sort of Puritan at best or outdated at worst. So Newman correctly believed that medical education and medical practice can never be value neutral. Unlike other prominent educators of the time, Newman's preferred method of influencing others was individually, rather than addressing them en masse. And he wrote, quote, "An academical system without the personal influence of teachers upon their pupils is like an Arctic winter," end quote. This also reminds me of Jesus frequently portrayed in the gospel accounts one-on-one with someone. Good teaching does not simply engage ideas and texts, but persons. We believe as Christians that truth is a person. We need an overhaul of medical education and people who are deeply involved in the formation of upcoming physicians. We need to recover from a mission of simply teaching content, although that's part of it, to a larger view of forming persons. We've lost the pastoral dimension of education. And as Fleischacker writes in John Henry Newman's vision of the Catholic medical school, quote, "We don't just want to prepare doctors for a long career of usefulness in physical healing, but more importantly, that they be vehicles for God's love and God's mercy. This is dignity affirming." Their education and professional formation has also become divorced totally from imagination. As Newman writes in his Grammar of Assent, quote, "The heart is commonly reached not through reason, but through the imagination," end quote. And as Matthew Briel writes in his paper, Why the Catholic Intellectual Tradition Failed, quote, "Once the imagination is engaged in a sacramental vision and the heart is transformed by it, there is an opportunity for a student to be drawn to the truth, contemplated, and rigorously debated in philosophy and theology. This development of an imagination forms students to work for the common good, for it is entering into others' experiences by the imagination that we are both drawn to act and can creatively develop ways to contribute to the common good," end quote. Where else is it as needed for people to be able to enter into the experience of others more so than the vocation of medicine? So yes, bring us your studio art majors. Bring us your students who have wandered with Captain Ahab aboard the deck of the Pequod, and those who have gotten lost in the notes of the Elgar cello concerto. As Professor Tillman writes in her book, John Henry Newman, Man of Letters, Newman saw imagination to be at the center of both religious and intellectual life, quoting, "The student of liberal learning must imaginatively enter into the complete circle of knowledge, which the idea of a university represents and allows its transforming view to take possession, to develop and be realized within. Imagination is here, seen to make present what is absent. in the richly creative sense of bringing to life or realizing, so to speak, a mere idea, end quote. She writes, the difference between the largeness of mind and the smallness of mind is the want of imagination. Newman writes, quote, narrow minds have no power of throwing themselves into the minds of others, end quote. And it's in this concept of mastery that imagination is often killed. Current assessment of learners in undergraduate medical education is done along competencies. And in graduate medical education, we do it along what's called the milestones. And as people progress, they progress along a scale towards mastery or attending level proficiency. And that's where the scale stops. And the public expects as well that the knowledge is obtained, the board exam's taken, and people have sort of come out of the system with all the knowledge they need. Society expects physicians to be absolute experts, and then we sort of kill curiosity. Curiosity through the realm of research perhaps is encouraged, but less so with other types of exploration. And the university has mirrored this way of thinking by becoming, in many respects, primarily research institutions. They are ranked by how many dollars of funding one has received by the NIH, et cetera, but less prestigious are programs to help people understand the large undergirding questions of their work. Newman saw the errors of this and helped encourage the university to be a place whereby people come to learn how to think, to be properly trained, informed, to have a connected view of things. Knowledge is an end in and of itself, and to keep asking our students what the point of learning this or that is, points to our utilitarian bent instead of focusing on what we should focus on, which is something Newman calls the real cultivation of the mind, end quote. And as he reminds us, although the useful is not always good, the good's always useful. And then the final problem is the loss of the vertical purview, the connection with the giver of life, the great physician himself, Jesus Christ. We have dignity because we are made by God, and as Christians are found in the image of his son. We have a crisis of burnout in this country in medicine that's in part, as many experts have found, due to a loss of meaning in one's job. And when we lose the transcendent goods in medicine, when we shift our focus from a patient to a disease, the job loses its high purpose, and a sort of nihilism sets in that eats at a physician's soul. In addition, the absence of tradition or eschatological horizon results in confusion of our own identity and purpose. Jesus is both in the great mystery, the suffering servant, and the great physician. What can a physician learn from this beautiful mystery? That in this job, in its sacrifice, there's suffering. We are witness to some of the darkest aspects of our lived humanity. It's not normal to see so much death on a regular basis. We're not able to cure patients in the way we long for them to be cured. This causes great moral distress. Our job starts to seem undignified. We are just putting Band-Aids on the wounds of humanity on which we can never get on top of in any real fashion, it seems. But when we realize that all not lost, that as Jesus says, I have overcome the world, we can rest in his work and the peace that comes from knowing him. And whatever suffering we endure, we can join to his passion and know that we have a high priest who will never abandon us and is with us in his spirit during every moment of our lives. It's when we lose sight of this that the nihilism sets in, the meaning-making is lost, and we languish in a sense of undignified, messy humanity without an eschatological lens. That's one of restoration and true healing. And if there are any faith-based physicians out there, which there are, many are made to feel like they aren't even allowed to bring their faith into their professional identity formation. And what happens is that one of the biggest meaning-making parts of their lives is sealed off from the other parts of their lives, and they become fragmented persons, and not the whole person themselves, who is expected in turn to treat and see whole persons. Most of medical education and medicine more broadly operates daily as if God doesn't even exist. If you can't bring the deepest part of yourself to your practice becomes impoverished. The consequences of all this are quite staggering. We have crisis levels of physician burnout, and burnout affects physicians directly with effects on mental health, increased risk of substance use disorder, and suicide. This also greatly affects patients. One of the hallmarks of burnout is depersonalization, and once the physician starts seeing the patient as a non-person, bad things happen. Physician burnout is therefore a patient safety issue. Our liberal education transforms us as human beings. If we instead are trained up in vocational training instead of being educated, these things are not the same. We instead will see how people, as how they fit into a construct of social utility. This is dignity unaffirming, and as Budmar writes in his piece, John Henry Newman in Catholic Higher Education, quote, a true Catholic academy would recognize the legitimate autonomy of each discipline, but would be blessed with the wisdom of the Creator in giving direction and unity to the whole of the intellectual endeavor, and be best placed to foster the true integral development of human persons, end quote. Because if we can't form persons, we can't expect them to see others as such. So to close, much is at stake. So how do we right the ship? By reclaiming a proper anthropology within medicine oriented towards and by the incarnate logos. To be able to reclaim the vision of a patient-physician relationship, we need to reimagine medical education built upon truth, realized through thick relationships devoted to the formation of one another, and encourage the immersion in a true liberal education to value and encourage the physician imagination. As Newman writes, quote, "The world is a rough antagonist of spiritual truth, sometimes with a mailed hand, sometimes with pertinacious logic, and sometimes with a storm of irresistible facts. It presses on against you. What it says is true, perhaps as far as it goes, but it's not the whole truth or the most important truth. These more important truths which the natural heart admits in their substance, though it cannot maintain the being of God, the certainty of future retribution, the claims of the moral law, the reality of sin, and the hope of supernatural help. Of these, the church is, in matter of fact, the undaunted and the only defender," end quote. So when Newman wrangled with the relationship between church and medicine, his goal is not to imagine a binary world between the spiritual and the physical, but to imagine the kind of university necessary to preserve the circle of knowledge in all its integrity. So whatever we may choose to do in prudential curriculum decisions, the wholeness itself and the effects of such an encounter with that wholeness is the overriding goal. Once more, if we want our students to see their future patients as whole persons, we must model this by seeing them in the same light. And as Budmar writes, quote, "By refusing to separate the natural and supernatural ends of human existence, John Henry Newman's stance points us towards a truly integral form of life, one that has the potential to renew a dying culture." Thanks.
Well, I want to thank both of my friends and colleagues who went before me for a few things. One, Brett has helped me out. I always just thought I used my notes wrong by going off of them, but now I realize that I'm showing technology who's boss. So thank you. I also want to thank Brett for sharing such an intimate detail about his wonderful mother, who I had the chance to get to meet, and sharing that story with us. I want to thank Kristen very much for allowing a dorky philosopher to call her up one day and say, "I have this intuition that John Henry Newman has a lot to say about medicine. And if you want someone who is an image of what she just got done talking about, we should make sure to meet her, who is infinitely curious about all sorts of things, but her willingness to share a friendship talking about John Henry Newman when she is an extremely busy person. I'm a lazy person, and she's a very busy person. And to give me the time of day, and I want to say thank them both. And I also want to thank them for something else. Because their talks were so content heavy about what these problems look like, I can do what philosophers like doing, which is just harping on a few points endlessly. But I think that they have a lot of cascading help to solidify what they showed so well. I've learned a few things at this conference, and one of them is to always say your point first so you don't run out of time, and then just elucidate your point further. I'll call this cascading meeting, because that sounds cooler. But there's also this aspect of cascading dignity, and really that's the point of what I'm saying. So I'll start with it. To oversimplify, the dignity of patients demands the dignity of healthcare workers, which demands the dignity of students, which demands the dignity of teaching, which demands the dignity of knowledge, which demands the dignity, especially, of the liberal arts. Everything else I talk today is just an elaboration of this point. Or, in slightly less oversimplified words, if you want healthcare practitioners who aim at the flourishing of the whole patient, rather than seeing them through the fragmentary lens of technology, you must treat them when they are students as whole persons themselves. Aim at their complete human flourishing, rather than as mere technicians whose only requirement is to practice medicine through a sort of download of relevant instructions. To do this well, we must treat knowledge itself with its proper dignity, recognizing that to flatten all knowledge into mere use, we begin to undermine knowledge itself, making it seem just like one tool among many others. The liberal arts, then, aimed at for their own sake, not only testify in themselves to their intrinsic worth, but dignify even the instrumental uses of knowledge as well. John Henry Newman, I want to claim, shows why all of these things we've been establishing is the case. Or one last simplification. Education and instruction are related but distinct. The latter, instruction, is primarily concerned about action or activity, or to use Newman's terminology, the mechanical. What then is education? Education is, as the aforementioned papers have pointed out, a cultivation of the intellect for its own sake, which the liberal arts aim to achieve, and thus the cascading dignity that I described above. As Newman puts it, quote, this is from Discourse 5, "This is the reason why it is more correct to speak of a university as a place of education rather than instruction. Though when knowledge is concerned, instruction would probably be, at first sight, the more appropriate word. We are instructed, for instance, in manual exercises, for these are methods which bear upon an end external to themselves. But education implies an action upon our mental nature and the formation of a character. When then we speak of the communication of knowledge as being education, we thereby really imply that the knowledge is a state or a condition of mind, and cultivation of mind is surely worth seeking for its own sake. Though distinct, instruction and education are bound together. And I want to say they're bound together in such a way that to trample on one has a profound negative effect on the other. To avoid the pitfalls illustrated so well by my colleagues regarding the profession of medicine and the instruction of its practitioners, we must attend to the necessity of this cultivation of intellect, even in settings like my school, whose main purpose is instruction. So that's my introduction, the argument, and I'll keep going until I run out of time. So let us begin with the elucidation, as it were. I lucked out into genius. I'm not saying I'm a genius. I'm saying I lucked out into genius because I was teaching the idea of the university, and I realized to make it a seminar, you need at least one more book, or they get mad. So I chose Etienne Gilson's The Unity of Philosophical Experience because I remember liking it when I was younger and, of course, had no clue what it really said. So here I am reading it with students, and I realized, guys, it was a genius move. I didn't mean to, but it's a genius move. Go read The Unity of Philosophical Experience back to back with the idea of the university, and you don't have to remember a single word that I told you. It's worth doing. However, I think that Gilson has a line that it's the salient axiom for everything else today. What is distinct can be unified. What is mixed can only be confused. What is distinct can be unified. What is mixed can only be confused. So the heart of my paper is that in order to appreciate the dignity of students, we must be mindful of the distinctions that persist in different types of education. I'm throwing out there that when we mix them, we cause the confusions that have the ramifications that my colleagues pointed out so brilliantly. Newman attends to these distinctions right out of the gate. He begins his preface, for instance, by distinguishing the ends of universities and academies. The former being places of teaching universal knowledge, the latter engaged in the discovery of scientific knowledge. Now, we, of course, would think that these two are combined in modern American universities. No one really gets at this idea that there's universities and academies. Modern universities in America mostly do both. But notice how it's important for us to recognize that these two ends are interrelated but distinct. Mixing them without this consideration confuses them. So even if we don't want to use the words Newman does, it's important to realize the academic aim and the university aim at all colleges persists, no matter what we call them. Newman also draws this attention in a more elemental confusion about education. For instance, in Discourse 6, he points out that the excellence of the body has a definitive name, health, and that the excellence of the moral life does as well, virtue. English, on the other hand, does not have a readily available word for the excellence of the intellect. So he just starts throwing out probabilities that don't quite work. Talent, ability, genius, judgment, taste, skill, wisdom, knowledge, science, all of them point to aspects to the excellence of the intellect, but they don't quite work the way health does for the body or virtue does for the moral life. So he goes fishing for new concepts. So he goes, this is philosophy. This is the philosophical habit of mind. It's the enlargement of mind. It's the cultivation of mind, the cultivation of the intellect, illumination. The problem with Newman is where one sentence will do, he always puts in 6. So I can understand how some people miss this point. But this is what he's saying is, look, if we don't make the proper distinction about what the end of the intellect specifically is, if we mix it with virtue or health, we make a mistake. He keeps this up. He'll bring this up in Discourse 5, for instance, where he points out that the manifold arguments throughout the years about what counts as a liberal art versus a mechanical art points to the fact that there's an underneath all of this, a abiding term, right? The liberal arts are something. Sure, in one instance, people throw in bodily arts like war and call them liberal. But on the other hand, mental arts like medicine at different parts in history are called merely mechanical. The argument might not be settled, but it points to the reality underneath it. There are arts done for their own sake. And the discussion points to this fact. These are just 3 examples illuminating my point. So these distinctions, university versus academy, lack of a word for the intellect that's like health, virtue, what counts as a liberal art, they can seem like splitting hairs, in which I'm like, welcome to philosophy. But certainly it's the case that words used in the 19th century for different types of education take on different connotations now. No one would argue that. The point is not to get hung up on the words, but to attend to the idea, in Newman's terms, of the term, if you're going to use Thomistic logic, the term underneath the statements behind the menagerie of the words. In other words, you don't have to end up using Newman's lexicon if you don't want to. You don't have to decide that education and instruction, that like here on out, we need to make sure to never use those words interchangeably. But we have to get at the idea that instruction and education, how he elucidates it, points to 2 ends, that if you mix them, you get the problems that they talked about, because you are mixing the ends for which education and instruction, as elucidated by Newman, demand. And of course, this is not only the case regarding distinctions between words. It's also the case about distinctions in the history of words. This entire conference is about dignity and how the idea of it has changed so radically throughout time. Again, providentially, if you don't remember anything else, Alistair McIntyre agreed with Beau Bonner. Just saying. That dignity, of course, begins its life as a word fit only for aristocratic and oligarchical groups. In a real way, dignitary existed before the concept of dignity. And I'm just plagiarizing my friend Eve Tushnet that pointed this out to me, that she says she's worried about using dignity as an overriding concept precisely because of its aristocratic pedigree. Now, for me, just to make a sort of side note, the reason I like it is because it reminds me of the sort of carnivalesque way Christianity throughout time has taken aristocratic words from the pagan world and turned them on their head. In this, I'm just plagiarizing Terry Eagleton in a book like Radical Sacrifice. Or maybe it's something more like Jonathan Lear's book, Radical Hope, where the idea is terms that used to have thick descriptions through seismic changes like Christianity becoming the dominant religion of the empire thin out and take new meanings. The point is, dignity has distinctions of terminology in its own history. And to attend to those is to help us with something we're trying to point out now. If you're asking me, we need to map an aristocratic aspect of dignity onto the modern world, which is to say, students deserve that aristocratic aspect of the free arts. The liberal arts are the free arts, but they're the arts of free people. And if there's anything that we're trying to do right in the United States education program, it's to extend this idea, this aristocratic notion that all humans deserve intrinsic knowledge for their own sake to as many people as possible. I can tell you that Okies, where I'm from, or people from Des Moines, Iowa, in the ancient world, were not considered in the idea when people go, dignity demands education. But we've got there now, and we should continue to map that on. Our students deserve it, and we should expend resources to bring it to them. But even more than this, Newman himself makes the connection between dignity and liberal knowledge. So again, Discourse 5. The principle of real dignity and knowledge, its worth, its desirableness, considered irrespective of its results, is this germ within it of a scientific or philosophical process. This is how it comes to be an end in itself. This is why it admits of being called liberal. Not to know the relative disposition of things is the state of slaves or children. To have mapped out the universe is the boast, or at least ambition, of philosophy. Liberal arts has a dignity that dignifies all knowledge. So we must respect the dignity of knowledge itself by attending to its intrinsic nature if we are to appreciate instruction and thus the people we instruct. Notice how this lines up with MacIntyre or de Koninck or Thomas' point about dignitas, that it's precisely something for its own sake as opposed to utilitas. And also that this intrinsic dignitas is also teleological for Newman, that it is grounded in God as a creator who has unified the fact of creation by creating it. And why to study it is to tend towards the unity of the circle of knowledge, as Kristen has pointed out so well in her paper. But Newman makes this point even more strongly by making an epistemological point. And this is where I'm really going to dork out, so don't fall asleep. It gets more exciting after this. Quote, I only say that knowledge, in proportion as it tends more and more to be particular, ceases to be knowledge. I'm going to read that again. This is crazy. I only say that knowledge, in proportion as it tends more and more to be particular, ceases to be knowledge. It is a question whether knowledge can in any proper sense be predicated of the brute creation without pretending to metaphysical exactness of phraseology, which would be unsuitable to an occasion like this. I say, it seems to me improper to call the passive sensation or perception of things which brutes seem to possess by the name of knowledge. When I speak of knowledge, I mean something intellectual, something which grasps what it perceives through the senses, something which takes a view of things, which sees more than senses convey, which reason upon what it sees, and while it sees, invests with an idea. He calls it an idea of a university, and like ideation for Newman is extremely, extremely important to understand his view of knowledge. I have 5 minutes left. I can't get into it. But I'll point out why this is important for here. It's here that he makes his biggest epistemological claim that in some ways, knowledge of particulars isn't knowledge at all, which seems outlandish until he points out that, of course, animals have this information too. But precisely, they do not infer anything general enough to be considered knowledge. So this is an exceedingly subtle point, which some people would act like contradicts Newman's, he just got done praising Aristotle just a little bit earlier. But this is where people misunderstand Aristotle. Aristotle is not saying that knowledge is sort of just like a brute running up against your sensory perception. Even Aristotle says knowledge is not properly knowledge in some ways until it is inducted, as it were, from the experiences that we have. It's not knowledge proper unless it is worked on by the intellect. And since perception is not equal to knowledge as such, even practical and mechanical knowledge is already more than simply a bald encounter with phenomenon. So it is incumbent on lower and more practical knowledge to pay tribute to the intrinsic philosophical nature of all knowledge. To cut that off is to topple the foundations of even mechanical knowledge. To make all knowledge instrumental is to start the unraveling, cascading path of all things not really being knowledge at all, but mere tools. To think that the mechanical or entrepreneurial or practical arts are mere sensory action is to render them something barely above what animals do. And I add this whole other point where you talk about, like, do animals really use tools? But we can fight about that later. Here I hope you begin to see the path this unraveling takes. If knowledge does not have an inherent dignity of something elevated above what even animals can do, even in its most practical uses, it starts to become subject in all its forms to mere utility, the background enemy to Newman and all of his debates. But if even knowledge is mere utility all the way down, then what of those who use knowledge? They too become a subject of utility all the way down as well. And all of a sudden, it starts to make sense that we speak of the incredible nursing shortages or difficulties health professionals face mentally and spiritually as burnout. I want you to think of that word. Humans don't burn out, machines do. Machines have parts that burn out. When we refer to human beings leaving fields like nursing and medicine and the allied healths and call it burnout, we've given up the game. They are just technicians that fit into a larger machine. And my claim is this doesn't just start with what we do content-wise. It of course has to do with this. Everything my colleagues say persists. But when you instrumentalize knowledge itself, you cannot help but end up treating humans like parts. And when you go march them into the pandemic, that's what got to me. My students burnt out because they faced something they never saw. And the thing is, you would think that this is a moral problem. And Bo, you're a moral ethicist. Why are you talking about this intellectual stuff? Here's the thing, folks. And Newman makes this point clear. Part of it is moral. Part of it is ethics. But ethics is not the intellect, and the intellect is not ethics. They're distinct. There are moral issues. There are psychological issues. There is mindfulness and all the things that people realize that are missing in the middle of this pandemic for our students as they become practitioners. But what they're missing is that you can't stop the tide of this if you do not think knowledge itself has an intrinsic dignity at root. If you do not do that, the whole cascade goes all the way down. And my cascading for the moment is done. Thank you.
Thank you very much to our speakers. We have 10 minutes before kickoff. So we'll open the floor to questions. If you could please identify yourself and your name and your affiliation. Well, she's at the microphone, so.
Is this on? Yes, it is. My name's Deirdre McQuaid, formerly philosophy student here at Notre Dame Philosophy and Theology. No current affiliation. I'm on disability as a patient. Thank you so much. I wanted to specifically respond to Dr. Collier's paper and say that there's a real role that we patients need to also play. It's not just your formation and your education, but also societal attitudes. I think a lot of what we as patients bring, I'm living with stage 4 breast cancer. It metastasized within just a few months of having treated the second stage. And so I may have months, I may have a year or so, but when my disease came back so quickly after aggressively treating it, my doctor had a really hard time telling me that news. You know, it rocked her to the core because she couldn't believe that it came back within just a couple months. And but I want to say, as a patient who's been called by name to belong to our Lord for all eternity, that's something that especially I think Christian believers can bring to our experience of medicine, and I don't mean to go on and on about this, but is our experience of living robust and always growing trust in our Lord. So if I can come as a patient and not put undue pressure on my physicians to answer everything, to alleviate all my fear, to take that away, to fix me, to cure me and control my health, and I do think fear is a big part of this, then if I don't do that, I'm effectively idolizing my doctor. Right. And no human can play that role, no matter how well-formed he or she is. So I just wanted to share that experience and propose that those of us, I mean, everyone here in this room either has been or will be at some point a patient facing some very serious issues, and that we can bring to that relationship a freeing, I love how you said, Dr. Collier, a thicker relationship, because and I'll end on this, when my doctor first told me the diagnosis, stage 2, I said, well, I know to whom I belong, and the truth will set me free. And that empowered her to be able to speak with me about my prognosis and what the treatments could and couldn't do. And I appreciated her openness to my openness, and her humanity is just profound. It's amazing. So I just want to introduce that as how could we encourage patients to bring that freedom to the relationship with the doctor and alleviate the burden of basically idolizing you. Thank you.
Deidre, you're officially the 4th speaker now. 'Cause that's-
Yes. First, I really would like to say how much I've really gotten from everybody's presentation in this panel. My wife is a scholar of Newman, but I'm also very interested in particularly the issues that have been raised, and I think by Dr. Collier here. And it seemed to me, here's the problem, and I'd like to see how you address this, is that we can have a really good internal dialogue in this conference here. We agree on certain premises, certain foundations. But when you want to talk to modern bioscience, talk to the researchers in artificial intelligence and molecular biology and so forth, you're running into a granite wall. Right. And part of that's, I think you've identified very well, is because of education. These people have been educated in a silo in which they see the world in such a way that they can't even understand your questions, right, while you're raising the questions, until they have some existential crisis of their own and they have to raise them. So the question that seems to confront us, and maybe you could comment on this, is how do we get that conversation going? Not by condemning the science, because I think the science is very important. It's by how we, in fact, get that person, those people, to think of these questions in the way in which we want to pose them. And I think that's a major challenge that I can see that we haven't really got a solution to yet. But I wonder if you would have some, I think you were working on a project in a major research university, hospital-driven environment, so you might be able to address that a bit, Dr. Collier.
Thanks, Dr. Sloan. And I wish Dr. Tillman could be here with us today. Just briefly, I think this is best encouraged in relationship across the disciplines. And I know a lot of our major academic institutions, mine as well, University of Michigan, has started some interprofessional, interdisciplinary collaborations with people who are coming together in solidarity and charity to be able to explore big questions. And I think our institution's making space for these and legitimizing these with dollars and time and space for these conversations is the best way forward, because medicine in particular, I can only speak from my own discipline, has been incredibly siloed. And I think in that silo, we've really gone down a bad path. And Newman talks about we've become self-contained, seeing our own discipline as higher than it is, and cannot answer the questions even though we think we can. And so to have conversation with our friends in philosophy and theology and English and anthropology and sociology and English, et cetera, is the way forward. So more of these huge, I think, sort of efforts to bring us all together to talk, I think, is the simple answer. But we need more of that, because without it, we're in trouble.
Yeah, I think we trick them. So what you do, so like this is what I did.
So I made a Center for Human Flourishing because human flourishing is this word that everyone's like, yeah, human flourishing, who doesn't want that? And then you walk them into the room, you close the doors, and you talk about this. So you trick them into talking about this.
I think Jeff had his hand raised before me. Okay. Hey, my name is Ethan Schimler. I'm a family medicine resident down the street. I'm in the 22nd grade of medical education, coming to the close of being spat out by the education machine. So I thank you for drawing attention to moral distress in medicine. It's a complicated, intertwined issue when we come up against death and all sorts of suffering. On the one hand, we're intrinsically coming up against evil. We're intrinsically coming up against the consequences of the fall, and that's going to affect our souls. On the other hand, we are often coming up against these things that are actually caused by medicine, and we feel some actual culpability in participating in not alleviating the human condition, but actually worsening it. And then thirdly, quite frankly, most people in medicine are quite morally and metaphysically disoriented. Right. And I take it that you propose the liberal arts and the great books as a prescription, an antidote to that. And I guess I wonder, how does one in a secular, pluralistic culture interpret the great books, interpret the liberal tradition? You know, when you don't have those shared assumptions, it's a similar question, I suppose, that was just raised. How do you go about that?
You're not going to believe my answer, but you trick them. Actually, I'm serious. But one of the things that's important in this sort of regard, I think, is I'll just make a negative statement, and then part of it is we need to work on it. But part of it when it comes to liberal arts is us liberal arts dorks are way too white knuckling that we have like a certain amount of the curriculum. Like, oh my gosh, we need this many hours. And so when you go talk to people in med school, they're like, where are we going to do the great books? What's important with Newman, and we didn't get into this one, but like I think in our paper, that's Church Life Journal we did, Newman doesn't have an idea. He doesn't go out and go, you need this many hours in this many different arts. Technically, if Newman's right, you only need one class if you're good enough at teaching it. And Newman brings this up, right? It's interesting in the preface, he points this out. Why should you learn grammar and math and poetry? It's not because it's a skill. It's because grammar and poetry and math teach you this grand idea about how knowledge fits into a circle. Mm-hmm. And so even grammar taught incorrectly, because Newman says the same information can be mechanical or philosophical. We don't need lots of the curriculum. You just got to trick them and do it early.
Jeff?
We got a couple minutes before kickoff.
Well, I was going to ask a similar sort of question because I was going to make it humorous. It sounds like doctors are tools, and the medical schools are where we manufacture those tools. And then I was going to make the point that medicine will always want to import. I mean, I wrote this in a paper once that we think humanities has a dose effect, right? So if it's just entering into the system and all of that. So that was going to be the question. Given and you trick them, yours going to be your answer. But it is a machine. We are all kind of all of society is this way, and there's a Georges Bataille, who's a French philosopher, said the only way to create meaning is to be wasteful of efficiency and time. And so maybe it means we have to be inefficient at this and always muddy the waters and muck up the works that make the tools.
Amen.
Thank you very much. It's noon, and I guess we can continue the conversation unofficially afterwards on our own. Thank you.